always been real attuned to that I don't want a power gradient.
Right.
Because that's not what psychotherapy is about.
Well, and part of it is work, right? The work of maybe psychotherapy, the work of some of these practices and disciplines in order to improve outcomes, right? And because there's been a lot of evidence that psychological work, whether it comes to mindfulness meditation, which is not necessarily just a psychological treatment, but
cognitive behavioral therapy,
right, others kind of work, so to speak, psychologically, has proven to help. Is that
exactly?
Right? Yeah,
exactly.
But it takes effort, right?
It takes effort. Dr. Jones does virtual reality.
Mm-hmm.
The work that's done here, either psychologically or with y'all or with OT or PT, it is time intensive.
So, and it takes some discipline. Actually.
Exactly.
And in order to show up and do the work and actually be engaged. Is that right? But that's because that's a little bit different from what we normally kind of prescribe for patients, which is a very passive way of dealing with your pain. In other words, I receive a procedure and I will get better. I will receive these medications and I will get better. Versus I got to do the work in order, either the psychological deficits or weaknesses that I've got, in order to enhance my, kind of psychological resilience. Or some of the occupational therapy, physical work, and or whatever it may be, it takes effort. So it's kind of this shift in the way that we perceive how patients get better. Yes, these meds can help. Yes, some of these procedures can help. Sometimes they don't.
Right.
And sometimes it's the work that is required in order to get better. Is that correct?
That's correct. But it's the ownership of their own treatment. And you think about the different generations. People that are my mom's age, dad's age, and yours too, they didn't even have the name of their prescriptions written on their bottles. You went to a doctor, the doctor fixed you. Take 2 of these and call me in the morning.
Right.
That's a cultural shift now that we've had to, I'm part of this team. And I'm responsible for my own getting better. And I tell folks, it's not anything magic about what you do here in my office or in this office regarding the occupational therapy, physical therapy. It's what do you take from here and use every day at home.
Right.
If you had a diabetic child, you would learn to handle the diet every day.
Yeah.
You would learn to handle the insulin every day. So, that's a shift in the culture.